And Mark, some of the larger clients that need a lot of help have been in the healthcare space, right? And we've had some recent opportunities to work with some healthcare servicers and healthcare organizations to better protect, their infrastructure and their employees, but also kind of address how the threats have emerged and matured from, the introduction of healthcare insecurity, right? Um, so a lot of the tailoring towards healthcare and compliance and detection and response Adlumin does benefits those organizations very much so. Is there something where healthcare has a specific use case for them that is necessary that some other providers are not really getting to where it need be?
Yeah, absolutely. I've always sort of joked, right? If your provider spells HIPAA with two P's, you need to show them the exit and maybe validate their parking pass, and that's about as far as you want to go. Because it's right, they don't understand the business, and certainly, Adlumin started in the financial services business. We have hundreds of healthcare clients as well, and we understand the world of regulations, right? And so HIPAA in particular here, and some of the others around healthcare. And what's important again is to understand what that means to the customer. So not just in the terms of protecting them, but what are some of the outcomes and consequences of those actions. So we want to make sure that any of the security actions we take are properly tagged and documented and audited, because of course we recognize that they are going to have, they'll have sort of the after conversations, potentially the audits, the reporting, annual attestations, and so on that occur. And so what we want to demonstrate here is that one, we can quickly and rapidly identify threats. Two, that we rapidly contained them and prevent them from becoming disrupting, and whether that's the operations or whether that triggers some kind of regulatory notification. And three, that we do it consistently, and that's what's really important. So again, our SOC is trained. They understand the context. They would understand, for example, if a system is their medical records or patient records system, why that's critical if we see access to it, whether or not we have to limit access if we see something suspicious that's going on or block it. Conversely, on the containment side, we also want to know, because we don't want to say knock a PAC server offline. So, it's easy to look at an endpoint and go, yeah, okay, I'm just going to, isolate or reset that endpoint, but they might take down a medical imaging suite. And then we understand the impact to sort of patient care and billing and so on. So we want to make sure that we don't do that. And then from a regulatory perspective, we try to pre-bake a lot of the sort of the hard or the heavy lifting into the platform. So we provide HIPAA reporting as an example. So what we can pull out of the security telemetry and activities and logs, we already sort of put together so that most of that material is there for them. Or I should say, all of the material is there, but what it leaves them is then, the other pieces that are outside of the auspices of Adlumin when it comes to doing, as I said, reporting, notification, attestations, and so on.
And I think with this client specifically, I remember one of the things that they had most of the praise for, right, is they were evaluating a SIM and an MDR solution, and we're coming from kind of one of the larger, more ubiquitous providers that things can get a little bit complicated with different modules, different services, so on and so forth. And one of the things that they were really appreciative of is they absolutely increase their just generic benchmark of prevention, detection, and the security of their entire environment. But we're also provided, like you said, a lot of reporting, not only on HIPAA, but also on things that were occurring throughout the environment, and kind of enabled their GRC function to have a lot more power than they had before. In tandem with, again, having a SIM and an MDR provider that was correlating between all of their different telemetry, opening from every vendor possible, right, whether it be through APIs or syslog or anything like that.